Hello, everyone. Thank you for joining us early. We'll be starting just a couple minutes after the hour. Hello, everyone, and thank you for joining us. We're going to wait just 2 more minutes, and then we'll start the webinar. Good afternoon, everyone. Thank you so much for joining us. Please note that we have started recording the webinar today. My name is Katie Pascal, and I'm a research scientist in early childhood at Child Trends, and it's my pleasure to welcome you to this webinar. We're excited to share with you early work to develop a pilot measure of young children who are healthy and ready to learn. Once this measure is fully developed and validated, it'll be a measure of school readiness for children ages 3 to 5. It'll be available at the national level, and over time, it will also be available at the state level. This measure is the brainchild of the Federal Maternal and Child Health Bureau, also known as MCHB, within the Human Resources Services Administration, also known as HRSA. You'll hear me refer to HRSA and MCHB throughout our presentation. Child Trends has had the good fortune to work closely with MCHB on developing the measure, and now we continue to work with them to refine and validate it. All of this work is overseen by an expert panel that includes several leaders in the child health and early childhood fields. You may be wondering why we're sharing information now about a measure that's still only a pilot, one that's still being refined and still in need of validation. And the reason we're sharing it now is because we need the input of early childhood stakeholders and leaders to make this measure as robust and useful as possible. Before today's webinar, we presented to other audiences of early childhood leaders, and today we invite you to join us in our discussion of what's possible. So on today's call, you'll hear from several folks who are close to the work. You've heard a little from me, Katie Pascal, and I'm a researcher working on the validation of the measure. You'll also hear from Reine Gondor from HRSA MCHB, and she will share the origins of this work and MCHB's plans for it going forward. Then we'll hear from Kristen Anderson-Moore, who leads the team of researchers at Child Trends working with MCHB to validate the measure. Chris also co-chairs the panel with Michael Kogan of MCHB. As I mentioned before, this expert panel provides guidance for the validation work Child Trends and MCHB are conducting. Finally, we have Catherine Tao, who's co-director of the Early Childhood Group, to share her perspective, informed by years of working closely with states, communities, and federal agencies. We're also happy to welcome Jessie Berlin, who works closely with Reine at HRSA MCHB, and she'll chime in as we go along and help us answer questions. We're going to go through this presentation at a pretty quick pace so we have time for your questions and comments. You can submit questions at any time using the question box on the right-hand side of your screen. We won't take questions, we won't answer them until the end of the presentation, but feel free to put them in there at any time. At the end of the presentation, if you'd like to ask your question orally, you can also raise your hand by clicking on the little hand icon on the right side of your screen, and we will unmute you. I'll repeat these instructions again once the presentations are completed. This webinar that we're recording will be made available to you Before I shift it over to Reine, I just want to ground us in a little bit of context around the issue that this measure is trying to address. This measure is really a landmark step forward to answer the question, how are children doing? And we've needed this type of annual population for some time. There are several things that make this measure particularly unique. First, we note that this measure is embedded in an annual national health survey. So this is a survey being collected by the federal government and the data is made available annually. So that means that with time, we can track this measure over time. The second thing that makes this effort unique is that it collects data on children prior to kindergarten entry, when they're ages 3, 4, and 5. And to date, we've not really had good population level data on children's developmental status year over year from children this age. What also makes this effort unique is that eventually we will have state data. And the state data will be comparable in terms of being able to compare state to state estimates on how children are doing, but also for states to track the progress of their children within their state over time. Finally, everyone loves free data. This measure is embedded in the National Survey of Children's Health. The data are made publicly available every single year, and you can use them at no cost to you. That makes this particularly exciting. Now, this work is just in its pilot phase, and there's a lot more work to do. So I want to quickly highlight for you our future analytic work, but Reem and Chris are going to unpack these a little bit more for us. So first, we are conducting validation activities across the whole measure, but we've noted that we need to pay particular attention to how to validate this measure for 3-year-old children. In addition, we're really interested in seeing how data from this measure fits with data that states are already collecting on children's school readiness at age 5. Finally, it is our long-term goal that this measure could be used at the community level, not just at the national or state level. And so we're keeping an eye on how to validate the work such that the measure could be used by individual communities. So you all on this call are early childhood stakeholders, and you know just as well as I do that momentum in early childhood has been growing for years, and there's lots of excitement and energy. And on this slide, we're just highlighting some of that momentum, particularly at the policy level. So we had child care development block grants being expanded. We're seeing a new round of preschool development grants that cover kids ages birth to 5. We're seeing federal investment and expansion in Head Start and early Head Start. And we're seeing lots of activity happening outside of the federal level. We're seeing activities at the state level and at the community level. We saw lots of governors running on a platform of early childhood. And we're also seeing lots of momentum coming from the private sector. Philanthropic efforts at the national, state, and local level are all prioritizing early childhood. So it's our hope that this measure will help you and others in the field continue to make the case for investment and support for young children and their families. And now, without further ado, I will turn the floor over to Reine Gondor.
Thank you so much, Katie, and thanks to all of you for joining today's webinar. As was mentioned, my name is Reine Gondor. I direct the Division of Epidemiology in the Health Resources and Services Administration's Maternal and Child Health Bureau. I know that's a mouthful, but it's up on the slide too for your reference. And in this capacity, I have the very good fortune of leading the National Survey of Children's Health, which is the source for the data that we'll be talking about today. So my goal over the next few slides is to first provide an introduction to the National Survey of Children's Health, just to make sure we're sort of all starting from the same foundation. And then second, to provide an overview of the Healthy and Ready to Learn initiative, sort of a Cliff Notes version of how we got to where we are. But before I do that, let me just say big picture. The overarching driver for the Maternal and Child Health Bureau to sort of do this work was that we know, as I'm sure all of you do, that the educational success of young children is really shaped by multiple factors, many of which occur before they have entered kindergarten. And because kids start to develop those skills and competencies that are needed to be what we call healthy and ready to learn, not necessarily school ready, but healthy and ready to learn, during those first few years of life, we also feel that early identification of kids who might be struggling to develop those skills is important so that we can really help target efforts to promote positive outcomes. And I would say more specifically, one of the specific areas that the Bureau really wanted to help with here is the development or the provision of data so that we have aggregate measures of young children's health and development, because we feel like this can help professionals across multiple disciplines at both the state and national level target those supports to children and families in need. And so that was a particular gap that we were working to fill when we started this work. So on the slide that you see right now, really just gives you a snapshot, kind of the background for the National Survey of Children's Health. Some of you may be familiar with the survey, and I just sort of want to start there and then carry you forward to the new survey. Historically, we've actually fielded 2 surveys with very different foci. So one was the National Survey of Children's Health that was initiated in 2003. And this was designed to produce estimates of multiple indicators of child health and well-being, as well as the contextual factors at both the family and community level that impact children's health. And to be really honest, we actually started 2 years earlier by fielding the National Survey of Children with Special Healthcare Needs. As you can imagine, this was a different survey, also designed to produce national and state level estimates, but really focused on estimating the prevalence and impact of special healthcare needs within the US population. So both surveys were fielded 3 times. You can see the dates on the slide, and they also shared some other common elements. They've historically been funded and directed by the Health Resources and Services Administration, although we fielded them through the Centers for Disease Control and Prevention and the National Center for Health Statistics. They were telephone surveys, primarily landline, with some cell phone samples added in towards the end of the decade. Both produce national and state level estimates, as Katie referenced. And they are representative of non-institutionalized children ages 0 to 17 years. So we cover the age spectrum for kids. Today's data that we'll be talking about is really just focused on the younger end of that spectrum, but it's important just to know that about the survey. And all of our data are parent or caregiver reported. Also, again, a factor that's important to think about when we're talking about measures of healthy and ready to learn. We came out of the field in 2012 with the last National Survey of Children's Health and ultimately decided to do a pretty substantial redesign of the survey, which allowed us to tackle this new topic of healthy and ready to learn. And then ultimately, the survey went back in the field in 2016, and it's really the data from the 2016 survey forward that we will be working with and presenting today. Next slide. Just in terms of the history and use of the survey, I think it's just important to mention this because it really is a driver, one of the drivers for how we got where we are today. First and foremost, the National Survey of Children's Health Data serves as the primary data source for both performance and outcome measures for our state Title V grantees. So these are, this is the Maternal and Child Health Services Block Grant Program, funds that go out to every state and jurisdiction in the country, and those folks all use National Survey of Children's Health data to track their performance. Once states are using the data for that purpose, we find that they also start using the data for other state level planning and program development. And in some ways, data usage almost trickles up. So certainly at the federal and national level, we use the data. Probably the big ticket item that most people are familiar with is Healthy People, but it certainly provides kind of an evidence base or a data foundation for a lot of efforts that the federal government pursues around children's health. And then finally, there have been, best estimate, thousands of manuscripts that have scientific peer-reviewed journal articles that have come out using the data, and this ranges in topic from individual conditions like autism and ADHD to systems level indicators like medical home and now healthy and ready to learn. Next slide. So this is a snapshot of the National Survey of Children's Health, sort of quick facts about the survey. If you are more interested in the survey as a data source, I'm happy to talk about this for hours. I eat, sleep, and breathe it. But we also have a fair amount of information on our website, including all of the questionnaires, non-response bias analyses, you name it. We've got a lot of documentation for data users. In brief, though, so as I said before, and directed by HRSA. We now field it through the U.S. Census Bureau because we are an annual cross-sectional address-based survey now, so we're no longer using telephones. Respondents self-administer the survey and provide us data primarily through the web, but also via paper and pencil if they wish. And the topical focus of the survey has remained largely the same with some key differences, such as the healthy and ready to learn content. We're generally in the field summer to late winter every year now. We conduct the survey in English and Spanish. It takes folks about 30 minutes to complete the survey online. And you can see the sample sizes noted here. We had a big sample in 2016, our first year back in the field, and now every year forward, we're going to be working with somewhere between 21 to 24,000 as our sort of target sample. And again, I think the big, one of the big distinctions about the NSCH is that it provides both national and state representative estimates. Next slide, please. So my last two slides are really designed to provide an overview of our work to date, specifically to revise the National Survey of Children's Health to capture aspects of healthy and ready to learn. For the purposes of this presentation and others, we have laid this out in what looks like a nice, pretty linear way. I can promise you it was not really a linear process. It was actually very iterative. But I think what these two slides do is sort of help you see the buckets of activities that we went through to sort of develop and identify questions that could be added to the national survey that would tap into this construct of healthy and ready to learn. So to that end, let me just run through these to give you a sense of what we did. We really started in 2012, honestly, when we pulled the national survey out of the field and decided that we were going to field a single annual survey and we were going to take that opportunity to revise some of the content. So we had a window of opportunity and we took it. In 2013, we really started to hear from our state partners, our Title V grantees, who said, you know, school readiness, healthy and ready to learn, young children's early development is something that we want to be tackling at the state level, but we don't have data. Can you please do something about that and help us? And so that really was our driver. It was the state saying, please do something about this topic on the survey, and that was our initial driver. We ultimately worked with our technical expert panel as well as experts from around the country, ultimately culminating in a meeting that took place with some of our federal partners, including the Department of Education, the Administration for Children and Families, and the Centers for Disease Control and Prevention, as well as Child Trends and other folks who work in this field. And we came up with kind of a rough set of items that we could at least start testing. We did engage in cognitive and usability testing, so how well do respondents understand these items? We tested the entire revised survey, which included the healthy and ready to learn items in 2015. And then through all of that work, ultimately came up with what we would call the production survey, the survey that went into the field in 2016 that produced the data, which will be presented today. Through all of that process, we added 22 new items to the survey, which along with a handful of other items which were already in the survey, ultimately resulted in 25 items identified that could be used to track healthy and ready to learn, both as a summary measure, but also different aspects of that particular construct. Before going to the next slide, one thing I do want to emphasize about this is that as you can imagine, despite the fact that we talked to lots and lots of people, this was a really new effort. And so we frankly could have kept going through this iterative process of talking to folks and refining items. We could have done that for years. And what we decided to do instead was take a bold step and really, in the absence of a gold standard, take a chance and try to come up with data that then as a field we could then reflect on and continue to refine and revise. So I would emphasize that pretty much everything that we have done has always been done with the expectation that it could be done better and that it will evolve over time, but that we owed it to states and to families and to communities and to kids to at least take a step. So that was our philosophical underpinning. I think it's important to just mention that before going too much further. In the next slide, and my last slide here, I would just note that for the last 2 years, we've really pursued what I sort of see as 3 concurrent lines of work. So first, as you can see in the sort of first 2 line items, we really did continue to do item refinement and revision. So we were just adding items. We were also making refinements to response options, things like that. Second, We recognize the importance of doing validation work, which was referenced in the intro to this webinar. And so to that end, we have awarded a validation contract this summer that'll be looking not only at the individual items, but the summary measures that have been developed based on those items, which will be presented in just a moment. And then finally, we've continued to do more outreach, and that includes webinars like this. It includes an expert panel that we've convened, and it also includes kind of getting our work out there through published and sort of formal and informal means to make sure that the field has a chance to respond to what we've done. So with that, I think I will go ahead and turn it back over to Child Trends. Again, I want to re-emphasize that we really welcome thoughts and ideas about both what we've done and where we can go forward. And I hope you will reach out to our team if you have specific thoughts and or recommendations.
Great, thank you very much, Reine. Child Trends is thrilled to partner with HRSA MCHB on this important project. Child Trends has focused for decades on strengthening the availability of indicators to monitor child well-being, first at the national level and increasingly at the state level. The National Survey of Children's Health has been a critical source of state-level information, but as noted, a measure of healthy and ready to learn with data from the early childhood years before children start kindergarten has been lacking. Developing such a measure for state policymakers represents a major addition to the stock of indicators for young children. As such, it is not a measure that predicts whether a single child is healthy and ready to learn. Rather, it is a population-level measure that can be used by state policymakers and advocates who seek to understand and monitor the development of preschoolers in their states. As others have said, this is a pilot measure, and it's an ongoing process as new data become available and as validation work proceeds. So next, as promised, is a deeper dive into the process of developing a population-level measure of healthy and ready to learn. As Reine noted, Child Trends work with HRSA MCHB to develop a pilot measure was conducted in 4 steps. The first step was to examine each individual item. Second, we analyzed survey items to identify domains. Third, we developed scales for each domain on a common metric. And fourth, based on these scales, we developed an overall index of healthy and ready to learn. We began by assessing individually each of the 25 survey items that might potentially be a part of the measure of healthy and ready to learn for 3 to 5-year-olds, item by item. As you can imagine, each item in a large national survey is expensive, so it is important to know which items are essential and effective. Specifically, we wanted to assess whether there was a distribution in how parents responded, whether parents would not or could not answer the items, and whether items were extremely lopsided, that is, items where many or most respondents selected the same response category. Well, not surprisingly, parents tended to rate their children on the positive end of each item. In fact, 2 items were so lopsided that they had to be dropped from consideration in the subsequent factor analyses. For example, nearly all parents described their preschooler as affectionate and tender. Importantly, though, there was very little missing data. Across the items, fewer than 4% had missing data. Well, we then looked to see how each item was associated with child age and parent education. We expected to see age differences and differences in competencies by parent education. This type of analysis begins to tell us if the items are valid. Do they measure what they were intended to measure? And encouragingly, we saw the expected age differences in children's skills and in their competencies as described by each item. And we also found differences according to parents' education. For example, 5-year-olds were able to count to higher numbers and were more likely to be able to identify shapes than 3-year-olds. Similarly, children with better educated parents were more likely to have these competencies. Next, in step 2, we examined how the survey items remaining after step 1 hang together in domains of healthy and ready to learn. We will show the items later. Right now, I want to share what we did to identify the domains. We started with the 5 domains of readiness shown here that were identified in the National School Readiness Indicators Initiative. Specifically, we assessed whether the 20 items sort into these 5 domains or whether they sort into other domains. This is called confirmatory factor analysis, and I want to acknowledge my colleague, Dr. Kelly Murphy, for her superlative work on these factor analyses. The goal was to assess whether these available items measure underlying factors that represent whether a child is healthy and on track to succeed in kindergarten. Well, we found, in fact, that the items are best represented by 4 domains, as shown above: early learning skills, social-emotional development, physical well-being and motor development, and self-regulation. I should note that the language for these domains is evolving, like the domains themselves, and could change as work proceeds. Well, as I mentioned, we tried to replicate the 5 domains, but we found that the items assessing language development and early literacy and cognition and general knowledge were very highly related, indicating that they represented a single domain of early learning skills. The next 2 slides share the items that fell into each of these 4 domains. 7 items fell into the domain of early learning skills. Child recognizes the beginning sound of a word, recognizes letters of the alphabet, rhymes words, explains things clearly, how high the child can count, writes their name, and identifies basic shapes. The self-regulation domain contains 4 items. The child keeps working until finished, follows instructions, is easily distracted, and sits still. The social-emotional domain also has 4 items. The child shows concern for others, bounces back quickly, has difficulty making or keeping friends, and plays well with others. The domain of physical well-being and motor development only had 3 items, and additional survey items are being sought. The 3 items so far are: child grips a pencil in their fist or fingers, or does not use a pencil; the condition of teeth, which ranges from excellent to poor; and health status, which also ranges from excellent to poor. One of the wonderful things about this work for me is that it embodies a whole child perspective. That is, it recognizes that readiness for school encompasses social, emotional, health, and cognitive competencies. Accordingly, the next task was to take the items in each of the 4 domains and turn them into scales on a common metric. And this is step 3. As you all know, children's competencies vary by age, so we wanted to address age differences in our coding. That is, while one might expect a 5-year-old to be able to count to 50, we didn't want to say that a 3-year-old who cannot count to 50 is somehow off track. Accordingly, we developed developmentally appropriate cutoffs for each item, taking into account the different response categories used for various items. So for each item, for children age 3, age 4, and age 5, we define particular scores as at risk, need support, or on track. These decisions were reviewed by HRSA and by several researchers who were not on the project. Once we developed cutoffs for each survey item, we assigned codes. At-risk responses were coded as 0, need support responses were coded as 1, and on-track responses were coded as 2. This means that for a scale with 7 items, scores could range from 0 to 14. A score of 0 means that a child got a 0 on all 7 items, while 14 means a child got a 2 on all of the 7 items. And on a scale with 4 items, scores could range from 0 to 8, where 8 means the child received a 2 on all items. Having done this, we then had 4 scales, but they had different numbers of items. In order to develop an overall summary measure, we needed to put them on the same metric. And to do this, we coded scores for each scale using the same labels that we used to code the survey items: on track, need support, and at risk. Here, On track is defined as having a top score on all of the items with room for falling short on 1 or 2 items. At risk is coded when a child did not even receive a score of at least 1 on all of the items. And the middle group, needs support, is comprised of children scoring in between the on track and at risk groups. Okay, what did we find? Well, this slide reports the proportion of children coded as falling into each of these groups on each of the 4 domains. In blue are the children scoring on track. In green are children in the needs support group, and in orange are the much smaller proportions coded as at risk. You can see that the majority of children are scored as on track in each of the domains, 59% for early learning skills, 78% for self-regulation, 82% for socio-emotional development, and 86% health and motor skills. Rather few are scored as at risk, 9%, 3%, 2%, and 2%. And modest proportions score as needs support, 33%, 19%, 16%, and 12%. Personally, I think it is very valuable to have indices for these separate domains because each domain is important and contributes to children's development and readiness. However, we also wanted to have an index that reflects the whole child perspective. How are children doing across these 4 domains? Accordingly, we sought to translate the 4 scales into an overall summary index, step 4, and we chose a very straightforward approach. We chose to summarize for each child the number of domains on which they scored as on track, need support, or at risk. These data can be presented in many ways. The following figure is one. It summarizes the number of domains in which children aged 3 to 5 are on track. Our pilot measure shown here summarizes the number of domains in which children were described as being on track in all 4 domains, 3 domains, 2 domains, or 0 to 1 domains. When we look at readiness across all 4 domains, we find that 42% of children score as on track across all 4 domains. Another 34% were coded as on track in 3 of the domains, while 15% were coded as on track in just 2 domains. Finally, 9% were coded as on track in 0 or only 1 domain. So this is the first ever national population level measure for preschoolers of healthy and ready to learn. Having said that, it is a pilot measure and not the last word. So we want to share some of the next steps that are getting underway. Fortunately, as you heard, HRSA-MCHB is very aware of the need for replication and validation, and a competitive award has been made to Child Trends and our partner MayaTech to continue this work. We all recognize that the best way to test the predictive value of this measure is to do a longitudinal study, so we can see whether preschoolers who do well on this measure actually do succeed in school. Of course, longitudinal studies take time and money to get up and running. The design work should ideally begin soon so the survey is ready to go when the measure is finalized. I hope that this idea is on someone's drawing board because I think it would be an invaluable contribution to the early childhood field. At the moment, we are fortunate to have funding from HRSA-MCHB and foundations to begin work on next steps to confirm that this measure is based on the right items, the right scales, and the right overall index. Expert review is a critical first activity. An initial expert meeting was held in 2017 and a second expert meeting took place last week. And your review is, of course, one of the goals of this webinar today. I hope that you will ask questions and provide input both today and in the coming weeks. Well, next is stakeholder engagement. The HRSA-MCHB project will support engagement with stakeholders to identify how they are conceptualizing readiness, the measures they are using, how they are obtaining data, and their interest in the pilot measure for use in their state. The statistical validation work will assess the stability of the scales for each domain overall and across gender, race, ethnicity, and age subgroups. and we'll be using new data for 2017 from the National Survey of Children's Health. Well, I was privileged to be part of the original design team for the National Survey of Children's Health from 2001 to the present. And the goal has consistently been to design a survey that would produce useful, actionable information for states and for the federal government. This pilot measure of Healthy and Ready to Learn is the latest example of the National Survey of Children's Health serving just that purpose. I'm excited to be able to continue contributing to its development. Now I will turn the mic over to Dr. Catherine Tout for comments.
Thanks so much, Chris. I'm really happy to be here today with you and Katie and Reem and Jesse to provide some brief thoughts on this groundbreaking new work. I've seen so many fantastic questions coming through the question box, so I know we're all eager to move to questions. But I did want to just reflect briefly on the promise of this measure and on the ways that this work can impact the field. So I know these themes, I'll mention 3 of them, will echo some of the points made by each of the speakers already today, but just wanted to emphasize those again because they're important. So first and foremost, this new Healthy and Ready to Learn National Outcome Measure fills a gap in our understanding of developmental skills in the years before they enter school. And as Chris said, the measure provides a whole child perspective. We're looking at parent reports of children's skills, which is something we don't often have available to us. And it's really giving us this wonderful snapshot of their development across the domains that are important for school readiness. This unique early portrait can complement the ongoing work in states and school districts to understand children's developmental status at kindergarten entry. So this work, looking at ages 3 to 5, can help us better understand what supports need to be in place as we think about those even younger children, the infants and toddlers, so that we can help them be on a positive trajectory as they age into the years before school. Second, and I have seen some questions come through on this important point as well, which is that the Healthy and Ready to Learn outcome measure provides an opportunity to better understand disparities among children and when and how disparities are emerging on school readiness. States and communities are prioritizing equity in their early childhood initiatives, and so we know that a critical step is to access data that can tell this important story for policymakers and program developers. The measure can be examined to identify whether and how developmental skills differ across children by factors such as race, ethnicity, language, and family income. And the disaggregated data used in this way can set equity targets at the state level. And then finally, we've mentioned this really unprecedented period of investment right now in early childhood at the federal, state, and community levels. So with expansion in CCDBG, the focus on birth to 5 and the new preschool development grant funding opportunity and early childhood initiatives happening in communities, it will be critical to use this Healthy and Ready to Learn national outcome measure to look at it over time. And now we've said we need to be patient over the next few years while the measure is being further tested and refined, but this measure really gives us the potential to track trends over time to help states understand the progress they are making with these investments and with the innovations happening at the state and local level in supporting young children. So I hope you also are sharing the excitement we all have about the potential of this work we've been discussing today. We think this measure can inform our efforts to improve not only the systems that support young children and their families, that critical infrastructure, but also ultimately the programs and the services that support children's school readiness. And bringing us back to the whole child perspective, these essential supports we need to remember are not only in early care and education programs, but they're also very critically in health and in initiatives to strengthen parenting and family resources. So we hope you'll stay tuned for continued updates on this important work, but in the meantime, let's get to your questions. I'm going to turn it back over to Katie.
Great, thank you so much, Catherine. We have several questions from all of you, and that just is so exciting for us. As a reminder, you still have time to ask your question. We'll get through as many as we can. There's a question box on the right-hand side, and I will be reading those out and calling on our different presenters to provide answers. You are more than welcome to ask your question in your own voice. You have the option to raise your hand, and my colleagues and I will unmute you, ask your question, and we will give you an answer. So I'm going to kick it off right away. We did have several questions during Reine's presentation that I think pertain to the design and sampling of the National Survey of Children's Health. So Reine, I'm hoping you can help us answer some of these questions. The first is, are you able to collect data on children who are attending Bureau of Indian Education or Affairs schools? And I think this question could be expanded to say, can you talk about your sampling of Native American children and families in the survey?
Sure. This is a great question. So direct response to your question, I do not know, based on the survey, whether or not a child for whom we collect data is attending specifically a Bureau of Indian Education or Affairs school. What I do know, based on the survey content, is that whether or not a parent reported that their child is of Native American or Alaska Native descent. So I can look at the data for that subpopulation. I can look at it based on what state they are living in. So I can look at the data for that subpopulation, but not specifically what type of school they might be attending, or whether or not they live on, in a tribal area specifically. And that is just by virtue of the way that we sample, which is again based on addresses, which is taken from the master address file, which the Census Bureau retains for all residential addresses. We don't stratify by folks just living in a tribal area, but we are certainly asking all of our respondents about racial designation as well as ethnicity, so whether or not they're of Hispanic origin or not.
Great, thank you. There's also a question about how we plan to account and correct for racial bias in the administration of the survey. So I'm wondering, Reine, do you know about how that work has been conducted with the NSCH?
Yeah, so there's, this is actually a very long conversation, if you wish, but I think there's a couple of ways to think about what we do. So certainly we apply survey weights to all of our data. So that's how we're able to sample a subsection of the nation, if you will, whether it's 50,000 or 20,000 kids, and say that it is representative of all of the children in the U.S. or all of the children in particular state. So like many household surveys of this nature, we have a sample, we apply sample weighting or weights to all of our analyses, and that's how we account for any number of potential biases, whether it be race and ethnicity, whether it be poverty, whether it be educational level or geographic status. So we apply those weights to our analyses, and then we run a series of sort of corrective analyses to make sure that we got it right. And then ultimately map our key estimates for the demographic breakdown of our sample against the American Community Survey, which is really considered the gold standard. So we do all of this. It's a fairly extensive process. It takes a couple of months to develop a weighting plan and to apply those weights and correct and all of those things. Ultimately, we produce a document called a non-response bias analysis, which basically says whether or not what we did, we actually think it worked. And we use estimates from other national surveys against our own to make sure that the numbers that we're coming up with make sense. You are welcome to peruse the non-response bias analyses reports for each of our surveys. With the 2016 is already up, the 2017 will be up shortly, and obviously we'll be producing this every year going forward.
Thank you. And just to confirm, is the plan for the National Survey of Children's Health to be annual from here on into the future?
Yes, that is the plan.
Fabulous. One other sampling question for you. Is there a mechanism to ensure younger parents are surveyed? So specifically someone like a teen parent, are they sampled as part of the National Survey of Children's Health?
They absolutely may be. I don't know that. I don't ask about parents' age in the survey, but certainly any household that is sampled and receives the questionnaire or the request to participate, if that teen parent, meets the qualification, which is basically, I am, knowledgeable about the child's health, they may go ahead and complete the, traditionally ask for an adult, but that wouldn't stop a teen from responding on behalf of their child. There's no real way for us to kind of go in and only target teen parents, for example, unfortunately.
Thank you. There is a question about accessing this webinar and other resources about this after the webinar ends, and I will give you all of that information at the end. So I am not skipping your question. There will be some information popping into our chat box that will have the link to the specific spot on our website on childtrends.org, where you can find information and resources about the National Outcome Measure of Healthy and Ready to Learn, as well as an email address that I'll spell out at the end where you can send more questions and continue the conversation. A question about variables in the National Survey of Children's Health. Since we're in the 21st century, I wonder if you take into account in some way the screen time our children are engaged in. So in the National Survey of Children's Health, are there measures of screen time? It's not, I can tell you, it's not a part of our measure of healthy and ready to learn. But Chris or Reem, are those questions available?
This is Reem. They are available. We didn't consider them as part of Healthy and Ready to Learn, but I do think that there's any number of variables, and I would also ask Chris to comment on this, any number of variables in the survey, whether it be special healthcare need status or prematurity or any number of variables that can be used as what we would call stratifiers of our analyses. So we might look at Healthy and Ready to Learn by the amount of screen time that a child has, or at least is reported by the parent to have. So not part of our summary measures as they are calculated now, but certainly a stratifier or a potential stratifier. I don't know, Chris, did you want to add anything to that?
Yeah, one of the remarkable things about the National Survey of Children's Health is that it does have a lot of information about the family and the community. So there are measures of neighborhood quality that you can use as a stratifier, or you can, of course, just look at them because you're interested in neighborhoods. There are measures of parents' decision-making when they're confronted with a difficult situation, as well as the standard demographic and economic variables. There are a number of measures of family process.
Great. And one last question along that same vein. Are there questions regarding nutrition and diet, which we might also look at as correlates of the measure? I'm adding on, I will say, that last piece to the question, but I think that's how it fits in.
Yeah, so that's a great question. We do have a single item on what we would sort of call food sufficiency. It is sponsored by another part of the federal government and the USDA specifically. And what that gets at is how often a family is able to afford the kinds of foods they should eat. So it gets at both sort of frequency and quality. So we have a single item on that. We don't, and we've, folks have asked this question over many years, and Chris, as a member of our technical expert panel, may remember these discussions and want to chime in. We don't historically ask about specific food consumption in this kind of a survey. It's done better through something like the National Health Examination Survey, or NHANES. But so it's not those types of questions, you know, sort of how many vegetables does your child eat or something like that, don't do well in this kind of a survey in the way that it's administered. But ultimately, we do try to get at that food sufficiency and adequacy question through at least one item. And I don't know if we need to do any more on that point, but.
Yeah, I think one of the strengths of the measure of healthy and ready to learn is that it does not exist anywhere else. Some of the data or topics is available through other sources, and so a single item that connects them is what you can do. You can't have a survey that's 2 hours long because people won't fill it out. So that the decision, as I recall, was made to really focus on something where there just simply wasn't any information and there wasn't a lot of demand at the state and national level.
Thank you. So we'll move away from questions that are about the survey generally and focus on ones that are about the measure. There was a question about, back in 2005, the Casey Foundation published a Getting Ready report, and it was a 3-year, 17-state partnership working on national school readiness, on the National School Readiness Indicators Initiative. How does today's presentation differ, align, or draw from that work?
Well, it certainly draws from that work in the sense that those were the domains that were used to design items, to select items from other sources. When we actually did the analysis, as I mentioned, then we ended up with 4 domains. We'll be going back to that, and it's possible that the 5 domains will fall out again. But when we correlated those 2 cognitive domains, the correlation was 0.97. It's hard to get higher than that. So they just were not separate domains. We combined them, and that's how we ended up with 4.
Great, thank you. And I'll actually field this question pretty quickly. Are the cutoffs for at-risk, needs support, and on-track different by age? The answer is yes. Our next question is, and it's a wonderful thought, and I don't know if anyone wants to take just a quick moment to muse on it, is I wonder if there is, could be, or should be a connection that can be made with ACEs screening.
Well, one of the interesting things about the survey is that there is a measure of ACEs, and that's adverse childhood experiences. And so it would be entirely possible to do analyses of, the scores kids get on this pilot measure relative to their experience of ACEs, adverse childhood experiences. It's a really an analysis that's waiting to be done.
Right.
Katie, this
we
is
have
Catherine. I just wanted to briefly, really quickly go back to that question about the 2005 report, to just say that I know that another component report, and something that I don't think was said today as clearly as we would like to say it, which is that we also absolutely think about the concept of, we need to think about I think at that point it was called the equation. So it was children's readiness for school, but also schools' readiness for children, and then thinking about capacity of families and communities to provide for young children. So just to say that while we're focusing really specifically on a measure of children's school readiness skills, we certainly all promote this idea that in order to think about this comprehensively and to think about how it can be actionable, we do need to think about these other pieces of the picture, which are the extent to which schools are ready for children and communities and families are supporting children. So I thought that was important to say, because we've gotten very technical in our details, but in fact, this is a really critical point of how these kinds of measures can be used in the future.
Yes. Thank you, Catherine.
That's a great point that also touches on one of the questions that we got that was fairly long, so I'll just try to summarize that they're wondering, do we expect too much of children by the time that they enter kindergarten? Are we pushing too hard, creating a growth of future mental health problems? And I think that touches on this very kind of tightrope that you're talking about, Catherine, of using this measure of children being healthy and ready to learn. We are basing on the developmental expectations that we have for children at that age, not on any particular state's policy about what they feel children need to be doing in order to be ready for school. But we recognize that there is this tension between what it means to be successful in school and what it means to be developmentally on track for school. So it is a really important conversation that we continue to have. We only have a couple more minutes. I do want to highlight that in the chat box, my colleague Kaylor has dropped in some information that might be useful to you. The webinar will be housed on our website on the landing on a particular web page that will solely have information all about this national outcome measure. So you'll be able to rewatch the webinar, look over the overview, share this with a colleague. On that web page is also an email address where you can send more of your questions after you've had time to share this with colleagues. In case you're curious now, that email address is mchb.hrsa.gov. Again, it's mchb.ready-to-learn.hrsa.gov. We still have a couple minutes, so we're going to keep rolling with your questions. We've had a couple of questions that kind of tie together about how parents view school readiness, and do we plan to do any work to measure teacher report of school readiness and compare that to parent report?
This is Reem. I can only speak for the national survey. I mean, we don't have any plans to field the survey with different respondents. We unfortunately really just have to stick with parents and caregivers. But certainly I think some of the validation work may be looking at ways to look across how different reporters may address certain topics. So I can certainly pump that over to Chris or others if they want to tackle that.
That seems a part of our long-term validation strategy does include validating the measure compared to other measures reported by other reporters. There's another question about if the data will be able to be disaggregated at the city or county level at some point.
Unfortunately, no. The way that we sample and the sort of sampling plan is really predicated on the fact that we have to produce state level estimates. In order to sort of revise the sampling plan to be focusing on different geographic areas, it really requires a totally different plan and frankly a lot more money. So at this point, we recognize that any number of our measures, not just healthy and ready to learn, but there are healthcare access measures and things like that that are also in the survey that we know folks would love to have at the sub-state level. We can't produce those. There's a lot of work going on around the production of what are called synthetic estimates, where you sort of use estimates from the NSCH and kind of use other data sources that do have sub-state data. That's a whole other ball of wax, but so there's ways to kind of do some creative analyses that might get you at that kind of information, but it will never come direct, at least for now, will not be coming from the National Survey of Children's Health directly.
Thank you for that. And we are just about to hit the top of the hour. I'm scrolling through and seeing so many wonderful questions. I do think a lot of the questions might be answered through our publication that we have on the measure. So some of you are asking for more detail on how we decided the cutoffs for at-risk needs support are on track, how we did that by age. If you'd like to see the items listed out, that information is available to you on our website, and please feel free to email us if you have additional questions or would like to continue the conversation. I also want to mention that on that website that we have in our chat box right now, and that is, if you go to childtrends.org, you'll be able to find it. It is called well, I'm not sure exactly what the project link is called, but if you poke around on our website, you'll find it if you're not able to access this link that's available in the chat box. We're also going to be writing a couple of pieces about this that will be available in blog form, and also a small feature on our website called 5 Things to Know about the National Survey of Children's Health. And seeing that the project name on our website is called the Kindergarten Readiness National Outcome Measure. So you can look for it on our website, childtrends.org. So we will have lots of resources for you to try to learn more about this measure, share it with your colleagues, and of course, we welcome your questions. So I'm sorry to kind of rush us through these questions and wrap us up here really quickly at the end, but I want to thank you so much for joining us, for your attention, your enthusiasm, and your sincere critical review of this measure. We hope that you will continue this conversation with us and that you have a great rest of your day.